Having spoken recently about the raging conflict in Nagorno-Karabakh, and also about normalization between Israel and a couple of Gulf countries and its repercussions on, say, the Palestinian conflict, perhaps it is time to recenter, to come back home, to come to London, and to welcome you to number 38 of Arm Wrestling with COVID-19 in London. Now, you don't need me to tell you that the number of cases of coronavirus are going up alarmingly. Open any radio station, look at any of our news channels, and the news is quite clear, quite stark, quite obvious. And in addition to the number of cases rising every day, it seems that there are no discussions between central government and the various city mayors, particularly in the Northeast and the Northwest, where it seems that the coronavirus is at its strongest these days. And to the best of my knowledge, there has been yet no proper discussion or coordination with Parliament here in London. So the predictions I get, the journalists, the correspondents, the experts, the epidemiologists, the NHS doctors and nurses and managers who come on our screens or speak on our radios, they tell me that the NHS will be overwhelmed in 21 days. That's 3 weeks. With NHS bed occupancy going back once more to the critical levels that we were struggling with last March and April and even May. Besides, we're being warned yet again, not that some of us don't know it, that other NHS-related cases, even serious cases such as cancer or mental health, or even routine cases and routine operations will once more lag behind. This had already happened. Those who were in the pipeline knew this, but then it picked up a bit and we thought, okay, maybe it's moving forward. But apparently, one consequence of what is happening today with the rise in the number of cases is that those other issues will inevitably lag behind again. And a good question is not only what is happening today, but what does this mean in terms of mortality rates in the longer run? Now, the government ministers and those who are speaking on behalf of the government say that it isn't making any decisions on the hoof, that it is being very careful, that it is weighing every decision. Is it really? I mean, we've had, what, 9 months of this, 6 months of this? And we seem to be going from one decision to the other, one measure to the other. And that applies only to England, because in our 4 nations that constitute the United Kingdom, there are different measures being adopted in, say, Wales, Northern Ireland, and certainly Scotland, as well as England. But it seems that yet another attempt will be made at simplifying the procedure so that we, mere mortals, understand the laborious thinking of our politicians. A 3-tier system will be applied soon. From, in a way, I would call it, and I think somebody else was calling it as well, I don't know whether it was Laura Kunzberg on Newscast or somebody else, the traffic light system. There is the red, the most urgent. There is the amber, medium urgency, and then there is the green, which is the least urgent. So is this three-tier system going to be applied soon? And will it address the spread of the virus in restaurants, in pubs, and in supermarkets, which, according to an official table I saw, are the three leading sources of infection, no matter what different people say about it? And if so, if there is a three-tier system and there is more closure, more, what would I say, stricter application of those procedures, what about support to businesses? Local politicians, say in the Northeast or the Northwest, are at loggerheads with central government on this matter. And I suspect that Chancellor of the Exchequer is under great pressure in order to try and help those businesses who are struggling or who are struggling again. So a question that is being asked now, particularly in terms of the Northwest or the Northeast, are these regions being used as petri dishes? In other words, as test tubes to try and see whether which procedure, which rule, which approach would work? And so are the measures also effective? Is it not really about the track, trace, and isolate procedure or app that really matters? That is key at the moment, absent a vaccine. Questions that go through my mind. I listen to Nicola Sturgeon. I've never hidden away my admiration of this politician. She's had a lot of problems, a lot of obstacles, but she always seems to be one step ahead of us here in London. So should we follow the example of Scotland? Or if we go further afield, are we now gradually going toward an Israeli scenario where the coronavirus is raging again? Or is it not so much a question of changing the measures, bringing new measures, stopping something and putting on something else? The measures of yesterday are no longer available today. And now we have, yesterday we had the 6-person measure, today we have the 3-tier measure. Is it this that we need to do in our attempt to harness this virus? Or is it a question of enforcement? I come back to the question of enforcement because it matters to me. I believe that the government is trying to do its best. Now, its best is not successful, but that's another matter. It's trying to do its best, but how do you define its best? I think, and you know this as much as I do, that the government, and particularly our prime minister, when he comes out and speaks to the nation, or when he tries to implement certain measures, he is pretty much sitting on the fence. Why, in my opinion? Because the dilemma he faces, the pressures he faces from different politicians and lobby groups, is that he has a choice between lives and livelihoods, health and wealth. Now, I'm not being cynical, I'm not being overcritical. I think I'm being realistic when I say that on the one hand, he's trying to harness the virus in order to contain it, in order to minimize the number of cases, in order to lessen the number of patients going into hospital or into ICU, and therefore the number of deaths. But at the same time, he's acutely aware of the economy and the economic situation reality in this country, and he is trying to do a balancing act. And in my opinion, trying to do this balancing act doesn't really work, because please all means please none. What does this mean? Does it mean that I'm advocating another national lockdown? Or alternatively, am I advocating that we forget the lockdowns and we go into herd immunity? This is not a choice that I can make, because I have the luxury of saying that I wasn't voted into office, I wasn't appointed to the cabinet, I do not have to make that national decision. What I need to do is to try and keep my head above water in this miasma of rules and procedures that keep coming and sometimes confusing me as much as anybody else, I suspect, in order to protect myself and protect my well-being and my health in as much as possible. But those who are making the decisions, they are in that difficult situation. And please all, please none is, in my opinion, the reason why we are where we are today, because we are adopting half-hearted measures. If we go too much toward lockdown, there are lots of people who say, but what about our businesses? This is unfair. Why is this borough like this and that borough like that? And if we open up the whole country and say, look, let's all get through this together and get some immunity, then what about the NHS, which will be hugely overwhelmed? It will collapse, it will capsize. And what about the huge number of deaths as well? So it's very difficult living in the gray zone when you have two clear options. Now, what I'll do in the description box, I'll also add a link to a BBC report, which gives exact numbers of cases, deaths to date and during the last couple of weeks, etc., and talks a lot more about this. So what I'm saying will be fleshed out by that report. But the fact that we're in a critical situation is clear and unavoidable. And to be honest with you, stuck between those two choices and unable to see that a vaccine will arrive soon, and unable to see that the app is working and that the track and trace measures are working as well as they should. Remember, we're not a banana republic. A banana republic might have difficulty in implementing some of those measures. We are leaving Europe because we think that we can stand on our own feet and be better globally without being tied to Europe. Hence the whole Brexit scenario. Shouldn't we be able, therefore, to prove how capable we are of managing our own lives and our own realities through this huge challenge, the pandemic that we face? Don't shoot the messenger. Look at the facts. Look at the link in the box and then decide. And I was going to speak about the political spoof that is related, the comedy, the irony, the tragedy that is related to coronavirus and President Trump in Washington, D.C. But you know what? I'm not going to go there because that's too much of a downer. That's another story for another day. Take care and all the best.